Hi, I'm Brandon Leonard, Director of Strategic Initiatives for Men's Health Network, and I'm here on Capitol Hill for part 2 in the briefing series, What's Happening with Boys, where we've been focusing on elementary school age boys. And we've been very pleased to have Dr. David Murphey, who is Senior Research Scientist at ChildTrends, to join us, and he was our opening speaker today. And Dr. Murphey, I just wanted to ask you for a couple of your thoughts on the briefing and maybe something that you learned today.
Sure. Well, I think one of the interesting and important things that we heard today was that when we're talking about addressing the needs of young boys, we also need to be thinking about the needs of their parents, because parents still are playing a very big role in the lives of boys, whether they're living with one or both parents. And often parents themselves may be in the dark about how best to address their boys' needs, and may have had difficult childhoods themselves. So I think it speaks to the importance of thinking in terms of a two-generation strategy when it comes to again, to addressing the needs of boys. We mustn't forget the parents in their lives and the grandparents and other adults who may be important to them.
As director of the data bank at ChildTrends, I know you have access to a whole lot of information that's relevant to this age group. And as you analyze this information, what are some of the key trends that you see and some of the key issues for boys, particularly in this age range in elementary school?
Sure. Well, I think just out of many that I could mention, one of the things we know about boys in this age group is that even at this age, more boys are overweight or obese than girls are, and of course this is a problem that's reached really epidemic portions in our society and actually around the world as well. At the same time, young boys are more likely to be physically active than girls are. So there's a bit of a paradox here that I think we don't have all the explanations for yet. But I think it's something that we definitely need to keep our eyes on, because there's a number of trends that are heading in the wrong direction here. I think there's still a lot of time that both boys and girls are spending with television and other screen-based devices that we need to think about posing more alternatives for in terms of active play, outdoor play in particular. So that's just one example.
And finally, I wanted to ask you, today we focused on elementary school, but we plan to have a part 3 briefing where we talk about middle school and high school kids. And some of the issues that we talked about today, I think we definitely are going to see some of the consequences in later ages. Can you talk about a few of those trends that we see from things that are happening at this age that are going to have a big impact later on?
Sure. Well, we know that boys are less likely at this point to graduate from high school than girls are, and they're less likely to go on to college. This is a reversal in some ways of trends that had a lot of staying power up until the last 10 or 20 years, when girls really started to take off in a positive direction, and our boys are falling behind in terms of a lot of the academic indicators. At the same time, one of the things that continues to be an issue for boys as they enter adolescence is an increased likelihood of behavioral problems, school absenteeism, and being involved in violence, either as a victim or as a perpetrator. So those are all things that we need to keep a close eye on as boys are entering into adolescence.
Well, Dr. Murphey, thank you so much for being part of our discussion today, and thank you for talking to me afterward. We really appreciate it.
Pleasure, thanks.